Hey, my name's Jason Colleran. I'm the owner and founder of Elite Edge Training Center in Atlanta, and I really appreciate the opportunity to present for the Georgia Athletic Coaches Association softball clinic. So we'll jump right in. We're going to talk about optimizing performance. So we're going to cover a variety of topics and have some cool visual aids just to kind of help reinforce the points. So how is this information going to be different? So a lot of times we see presentations where they might give a lot of clinical research or data, things like that, but they don't really have the hands-on experience. So what's going to be different with this is I've got about 30 years of experience with sports injuries. So at this point, I've just about had to rehab somebody through just about everything you can think of. Over 10 years as a muscle specialist and performance consultant. So I went through the muscle activation techniques program out in Denver, which is all internal performance. So knowing specific muscle testing, musculoskeletal mechanics. And then after that, I went through the resistance training specialist program, which is all about applying external force or external resistance and combining that with internal resistance. So I founded Elite Edge Training Center in Chamblee, Georgia. Also went to Chamblee High School in 2012. So here I teach continuing education and also consult for medical professionals and strength coaches. So I'll get a lot of people sent to me where maybe the orthopedic surgeon or physical therapist can't really figure out what to do with their athlete or patient. So they'll send them here and we can do some really precise muscle testing and get them kind of back to speed. Also developed the first stress reduction sleeve to increase velocity and prevent injuries. So that's the kinetic arm. And we won the 2020 ABCA Best of Show for most innovative product. So what I did is basically developed an external muscular system so we can offload stress from the shoulder and elbow and keep these athletes on the field. So the big topic we're going to talk about is how stretching can be killing your velocity and performance and also potentially contributing to injuries. So we'll have some good visuals here. So one of the big questions, or a couple of big questions, is why do we stretch? So a lot of times we just stretch for flexibility. We want to increase our range of motion. So we have this misconception that if we have more range, we have more power. So we're going to dive into that a little more. Also, it's just kind of automatic. It's just what we've done. But we've got to remember, if we do what we've always done, we get what we've always got. And we've got a lot of arm injuries. So we're going to look at how to kind of fine tune that and some better things that we can do to keep our athletes more stable. Help relieve soreness. So that's going to be kind of subjective. There's no data showing that it gets soreness to go away any faster. Nothing objective for sure. Gets the lactic acid out. So lactic acid actually metabolizes in your body within 20 to 30 minutes. There's actually a study done in 1936 or 37. So a study done about lactate and how it metabolizes, which is lactic acid. So the soreness that you feel the next day or the day after is just inflammation. So instead of sending the athlete out to run poles or do a lot of active recovery stuff that may beat them up more if it has some impact, we've got to remember that lactic acid is metabolizing their body no matter what. So it's not going to be there giving them issues the next day. Prevent or treat sports injuries. So also no data showing that stretching prevents or decreases the risk of sports injuries. So we're going to see a lot of cases where it's actually the opposite. So kind of the dosage determines the poison. So if we're trying to push that range and get more than our structure won't allow, we can actually cause impingement that's going to lead to a lot of issues. And then we'll also talk about fascia. We hear a lot that people think they're stretching fascia, but it's actually not possible. So it has a 2,000-pound tensile strength, the collagen fibers that make it up. So you'd have to stretch with more than 2,000 pounds of force to actually get a change in length. So muscles don't stretch. I always ask people, after all the years of stretching your hamstrings, why aren't they hanging down behind your knees? It's kind of funny when you think about it, but your muscles don't stretch. The fiber arrangement can change from eccentric to concentric. So cool visual for that. This is kind of like a muscle, like the muscle fiber. It's called sarcomere. So we have eccentric and concentric. So it's almost like letting it elongate and then having it contract. So there's not going to be elasticity here, all right? So the muscles do not stretch and they are not elastic. So a good visual for that. If I drop this ball, my muscles were elastic, it would kind of go like that, right? Unless I hit that elasticity off button. So you can see I can just grab it and stick it, but I didn't have to turn the elasticity off to do that. So also think about when you're running and jumping or sticking a landing, you're not kind of running on pogo sticks or springs. So muscles absorb and produce force. So in this video, this is what your joints would look like. We always hear that your muscles, your tendons, your ligaments are elastic.
No ligaments.
So he has no ligaments in his knee. But this is what your joints would look like if everything actually was elastic, because again, you can't turn it off and on. So you can see he's got a lot of give in that knee because, you know, the ligaments are gone. But we can actually stabilize his muscular system. He's actually a 3-time super heavyweight world champion fighter. That's a client of mine, but we stabilize his knee and he's able to go perform at the highest level. So definitely no stretching there. So we talk about how stretching can hurt your performance. With kids, we can cause hypermobile joints, which is going to definitely give them problems down the line. So we see people that are hypermobile, and what can happen with that is we're stretching out the ligament and the connective tissue that shouldn't be giving at all. We almost deform the plasticity, so now it's a pathological issue. So that's definitely something to watch out for. Humeral torsion. If we keep stretching the arm back as they're young and these bones haven't fully formed, this also happens with weighted balls. That's why it's not a good idea to throw those. Another reason is the increased valgus stress here at the medial elbow. So when you're throwing back, you can actually get this arm to permanently deform because it twists if we're putting a lot of force on there. So that's definitely something to take into consideration with these kids. We don't need to be stretching them out and trying to get more range. Causes strains and sprains. So that's another thing with stretching out kind of the plasticity of the tissue, especially the non-contractile tissue, so like the tendons and the ligaments. Decreasing stability. That's something we'll talk about quite a bit because muscles stabilize joints. So we've got to remember, kind of like the skeleton can't stand up because there's no muscle tension. So that's something that we'll dive into a lot deeper. We can also potentially attribute to little league elbow, Osgood-Schlatter's, and Sever's disease. So this happens because we'll have a lot of pulling. So with little league elbow, we have it here on what's called the medial epicondyle of the humerus. So the forearm flexors go down and attach here. As we go back and they keep pulling forward, pulling this hand forward with the ball, or with the knees, we get Osgood-Schlatter's because that's where it's called the tibial tuberosity attaches. Then down at the heel, it's Sever's disease. So when we have growing pains, we have to remember that the bones grow at a faster rate than the muscles. So now we have these longer levers that we have to produce force for. And sometimes some muscles will shut down because they're overworked. So other ones are going to tighten up. And then what can happen is if we keep training when they have that pain, you can get what's called an epiphyseal fracture, where actually part of the growth plate will kind of crack away. So definitely something we want to take into consideration. With adults, so stretching is actually going to decrease your force output. So there's a lot of studies showing it could be 30 to 60 minutes after is when you're going to feel the effects. I know for me personally, when I had a coach that wanted us to stretch out as much as we could, I could lay my arm 90 degrees more this way, so it's flat on a table, and I'd go down to like the mid 80s. And then when I wasn't doing that, and I was hitting the weights and my shoulder was tight, but again, tight is stable, I could get back up to the mid 90s. So I definitely have a lot of experience with that. Causing impingement. So especially with the shoulder and the hips, we'll look at some structural pictures. But if we're trying to take this arm, you can see here this gap. So we've got the acromion here, and we've got this humeral head. So if this scapula isn't moving right, and we bring this up, you can see how we're going to get impingement there. And the rotator cuff's actually pretty thick. So we're getting impingement sooner than you realize. So if we're trying to jam this arm up and back here, we can be doing a lot more damage. Definitely a lot more harm than good. So I had an issue with that where I would keep pulling my arm across. And then I realized one day that it always hurt when I pulled my arm across. So I stopped doing that and shoulder pain went away. So we always have to remember that structure dictates function. So sometimes the joints are not going to allow for you to get there. Mobility minus stability is vulnerability. So as we stretch everything out, we try to get more range. We're decreasing the force output of those muscles and also the contractile efficiency. So if you think about it, if muscles stretched and they actually got longer, when we run, we would hear our joints and feel them kind of banging and clanging because they're not stable and not pulled together. So that's another thing to take into consideration. Also, strength and stability decrease can lead to inefficient mechanical changes. So this is really big for throwing athletes. So if we're stretching out a lot of things in the hip and shutting that down, it's going to cut down on the rotation we can get from the trunk. Same thing if we lose function, if we roll an ankle, it stretches everything out and then you decrease your force output. So from the ground up, we've got to make sure that we're not overstretching these things. And then of course with the trunk and then with the shoulder too. If we stretch our shoulder out a lot and it's not stable, it directly affects how we function at the elbow. So that can also lead to more throwing injuries. So when we talk about structural limitations, we can see there's what are called structural deviations here. So we shouldn't all have the same range of motion because we're not all shaped the same. All right. So here, if we look at the top of the femur, you can see the change, actually the difference in length of the neck of the femur here. And then if we look at, this is called the acetabulum, the hip socket. So one is more like side or lateral facing. One is more kind of anterior facing. So this person may be able to do a split, and this person's probably not. All right. So we've got to remember that not everybody's going to have the same amount of range. I've seen in some certifications where they talk about trunk assessment or assessing range at the hips. They give kind of a preset number that they think every athlete should have. Had some race pictures on the table, and they don't have much internal rotation at all. And that's perfectly fine. So it's more about controlling the range that you do have versus thinking that everybody should have the same amount of range. Because when we start stretching this out, we've got a labrum around there in that socket. So we can also be doing a lot of damage to the labrum and, of course, shutting muscles down. So another picture here, you can see the neck of this femur actually has an angle. So just showing some differences in structure. And this can be at every joint. So we shouldn't try to take everybody to an extreme with stretching and thinking that they need more mobility. What we actually need is to make sure the athlete's stable. So here's a good example. This guy can do the kind of seated 90-90 stretch. This guy's trying to do it, but you can see these arrows here. He's getting more lateral flexion to try to make up for that range. And this knee is also slightly abducted from that midline. So one thing that I always ask is, why would you feel the need to go into that position? When you're running, when you're throwing, when you're hitting, you don't get anywhere close to this range. So I know there's a big craze and big fad with mobility and flexibility, but just remember the injury rates are not going down. So it may be time to take a step back and kind of think, why are we doing this to ourselves? But there's certainly not going to be any benefit from doing something like this. So not only at the hip, but also at the medial knee, his MCL is going to have a lot of pull, a lot of a distraction force. And we also have a lot of compression on that lateral meniscus too. So if you're doing things like that, please rethink it. I've even seen a presentation where they had somebody holding a kettlebell or somebody pushing them to kind of force them into that position. So remember, we've got to respect our structure, because if we can't get there on our own, we probably shouldn't be forcing ourselves into that range. Some pictures that are kind of hard to see on the shoulder, but there's little bone spurs in there. So on these x-rays, this is a good reason. So we've got a bone spur down here, a bone spur down here, also called osteophytes. So we also need to take into consideration there could be limiting factors that we don't know about. All right. So unless we had x-ray or MRI, if you're trying to stretch your athlete back into that range and it's causing pain, remember, pain is an indicator that something's wrong. All right. So we probably need to back off and not worry about how much range they can get, and instead worry about, is that range stable? But just something to keep in the back of your mind when you're making sure your athletes are functioning well. This one may be a little hard to see, but this spine, this is one of my athletes. His scoliotic curve is extremely bad. So he's not going to be symmetrical if we're looking at trunk rotation assessments or even like glenohumeral flexion here, because the scapula is not going to be stable on that thoracic spine. So another something to take into consideration, your athletes will have structural limitations, and nobody is perfectly symmetrical. So if you're aiming for symmetry, kind of worry more about stability. So let's talk about, why do muscles tighten up? So if we think about homeostasis, your body always wants to function as efficiently as possible, right? So it's not going to let you go into these long strides where you're less efficient. And then, of course, muscle stabilize joints. So we have to have a certain amount of muscle tension around a joint to make sure it's stable. So sometimes what can happen, if you think about like a tent post or a radio tower, we have those guide wires coming down. If one comes loose in the ground, the other ones have to hold more tension. So sometimes with throwing athletes, we'll see they have kind of an anterior tilt here with their shoulder. And that's because the muscles that do retraction and elevation aren't holding the tension they should. So what happens is this front side kind of tightens it up. You can also see this if you internally rotate a hip. If on one side you have less active internal rotation compared to the other, but you can passively take it further, we know that something's shut down and not working, and it's a neurological issue. So other muscles tighten up as a protective mechanism. So that leads into the next one. It's a neurological protective mechanism. So your body knows, or your brain knows, when it's always trying to orchestrate a movement or a solution for a movement, it knows what's available and what's not available. So it's going to keep you from going into ranges where you feel you might need to force yourself into it or kind of passively stretch to get there. So that's something to take into consideration. The brain is very, very smart. So if we get cut, our blood coagulates and forms a scab. So it's a protective mechanism. If our temperature starts to go up, we perspire to regulate it. So it happens automatically, another protective mechanism. So just keep that in mind, that muscles tighten up for a reason. Also, stress, trauma, or overuse. So if you've overused that muscle or that tissue, it's probably going to be tight. So again, your brain knows that it doesn't have that threshold to participate. So it's going to kind of call on the other guys. And that's when we develop the compensation pattern. So always remember too, that tightness is going to be secondary to weakness. And that leads us into muscle inhibition. So if on one side of the joint, it can't effectively lengthen, it's probably because the other side can't effectively shorten. So a good example of that is we'll see guys that kind of have an elbow flex position or had it with catchers after a knee replacement. They can't get the full extension with their legs straight. So they'll go to PT and they'll kind of force it down and try to smash weight on it. And then they'll come into my office and we'll activate the knee extensors and put tension in those, and then the leg will go flat. So instead of putting them under and doing a manipulation under anesthesia and cranking it down, neurologically, we can get those knee extensors working, those quad muscles, and it allows the leg to lay flat, or the leg to lay flat. So just some things to take into consideration. So back on mobility. So we have a big obsession with mobility now. We've got a lot of mobility tools. We've got this misconception that mobility is kind of this magic unlock to performing better. So mobility is kind of range of motion focused. And again, range of motion isn't nearly as important as an active range of control. So that's one thing to look at with athletes is, am I worried about how much overall motion I can get? Because again, there's always going to be a structural limitation because you have bones that only go so far. So instead of trying to worry about range of motion and how much they can get, we need to worry about if they're stable in that range. So what is their active range of control? Another thing to think about too, if this is all the active external I have, it's kind of crazy to think that if we force this all the way back, I'm going to be able to produce force there. So if you can't get there on your own, you're probably not going to be able to produce force there. So we're just kind of opening up a weak spot, and that can happen with elbows because when we tire everything out and stretch it out, as we come forward, we have that separation force there, that dynamic valgus, and that's when we get a lot of stress on the UCL. So with mobility, also focus on as much range as possible. But again, remember, muscle tension stabilizes joints. So as we stretch out those muscles, and another thing, the dosage determines the poison. So we're not damning stretching completely, but there needs to be a goal and a follow-up as well. So foam rollers and lacrosse balls, things like that. Let's take a step back and think, why are we beating the crap out of our muscles? It's kind of funny when you think about it, and I joke and say, just get a hammer and get it over with. But we've got to remember, your body's not playing a joke on you when it tightens up a muscle. It didn't play a joke on you and tie a muscle in a knot. So that's actually, if this upper division of the muscle isn't holding the tension it should, the other part might tighten up more, and that's what that knot is, all right? So we've got to make sure that we can get that muscle firing and contracting on demand and stable, and then we can get rid of that symptom. But if that's a protective mechanism from your brain, then we kind of don't want to beat that up and leave ourselves more vulnerable to injury because, again, things tighten up for a reason. So that and also release techniques. We hear a lot of times people say your TFL is tight. It's actually not physically possible. That fascia and the TFL doesn't have contractile capabilities. So if it can't shorten, it can't lengthen. And back to the collagen fibers that make up fascia have a 2,000-pound tensile strength. So if you think just kind of beating on that and rolling it is going to give you more than 2,000 pounds, then it's not going to change at all. So we got to be careful and think, okay, I am really beating up that lateral quad muscle, the vastus lateralis. So that could lead to more problems with internal rotation potentially. So along with the release techniques, so we got the collagen fibers that make up fascia. So the studies that show when they try to actually stretch fascia or a TFL, they can use hundreds of pounds of force for several hours, and there's never even a 1% change in length. So in terms of thinking that it stretches, it doesn't. Going back over here, active range of control, muscle stabilized joints. If we talk about stability training is not balance training. So this is something that we need to take into consideration. I know in the performance world with strength coaches and personal trainers, we'll see all these balance discs and wobble boards and things like that. So if that athlete is not stable on a stable surface, why would they be stable on an unstable surface? So we have to think about it. Unstable plus unstable is making the compensation pattern worse, all right? So if you already have some muscles that aren't participating, they're not going to automatically turn on when you challenge them more. You're just going to reinforce the compensation pattern. And I know this because I had my pec ripped off the bone for 2 years, and I had it put back on. And I was at a upper extremity class for muscle activation techniques in Denver. And so my pec was put back on. I went through all the physical therapy, and I couldn't hold a contraction at all. So even though it was attached and it was supposedly working, neurologically, it just wasn't firing. So that's something to always take into consideration. We're always worried about how bright the bulb is, and we don't know if the switch works. All right, so we definitely got to back up from there. End range isometrics are an absolutely incredible way to put that muscle into a shortened position, put a light amount of force into it, and then neurologically get it to turn on, so you can actually do a muscle test and hold that position. So that's what you really want to focus on if you're trying to increase the range of motion. If you're interested, you can always stop by my office and I can show you how some of that muscle testing works. So this is muscle strength. So this is beginning, and as we go up to the middle, that's where we're the strongest. End range, it drops off drastically. All right, so if at end range, our muscles are the weakest and can give the least amount of force output, if we're stretching it past that point, we're definitely not going to be strong in that position. So just going and back to my pec ripping off, I only had this much active range, and then the weight passively forced me down. So trying to produce force there is when it just snapped right off. So think about that when you've got, athletes throwing and you're stretching their arm all the way back. You're now putting them in a weaker position. So then the stress is going to go to the passive connective tissue, which is going to be like the medial elbow and the UCL ligament. Same thing for the rotator cuff. If we're really stretching out that rotator cuff and the internal, external, all the way around, and then we're asking the athlete to produce a lot of force with it, it's not going to be an optimal situation. So with resistance training, we have to back up and think. I've heard some presentations where people will say, I believe in maxing out. Yes, it does exist. However, risk versus reward. So again, I was maxing out. I never would have done it, but the strength coach had, his USA weightlifting and all these certifications. Look great on paper, but we got to think, what is the goal? So we had to, of course, go all the way down to the chest, right? Even though I don't have that active range. So what happened was I went down into that range passively, and then the pec ripped off. So think about that with your athletes. Is it worth it? Let's say they get a cool number, they get to brag about it. If they don't, they could potentially be injured, and then you lose a good athlete. Not only maxing out with the muscle issues, but also with structural issues. If we've got athletes that are still growing and their growth plates haven't fully formed yet, we can be doing a good bit of damage as well, especially with some of the positional stuff. Another thing to think about as well, active range of control. So I see this a lot with athletes. If they're taken into a range where they can't produce a lot of force, just mechanically it's not efficient, what can happen is you can definitely get injured. So when we talk about that, CrossFit a couple years ago, I know some teams have been going to CrossFit places. So here's something to really think about. There were 50-something pec tears in the CrossFit games from dips. And here's why. Because if this is all the active range I have, if I have the load of my body crashing down that inertia into a range I can't actively get to, that pec elongates. And again, we can't produce much force there. So if you think about 200 pounds crashing down, think about a 5-pound weight, placing a 5-pound weight on your foot versus dropping one from up here. So force is mass times acceleration. That's going to be a lot more load than the athletes are ready for. So always think about that, the available range of control. So when you're doing exercises, when you're going back here, trying to do all these crazy motions, remember, just like you see here, that the structure dictates function. So we can't wrap this arm around our body. We can't wrap it up over our head. The shape of the bones is going to dictate how much range we actually get. All right. So always think about that. We don't have to have a preset choreographed point A to point B. It's more about the intention and what happens between point A and point B. So another thing with resistance training is, what is the goal or the desired adaptation? So that's always something to take into consideration. We see people that say, oh, I just lifted. Or if I have someone say, oh, I did this much on lunges, I'll say, okay, what was your goal? And there isn't a goal. They just want to use heavy weight. But on lunges, we could do knee extension, we can do hip extension, we can do a combination of both. We could have lateral lunges, we could have stationary lunges, the drop back lunges. There's so many different things that we could focus on. Even with a squat, we could be pushing into abduction, so we're challenging our abductors more. As we're squeezing, we could have our weight back on our heels to work more hip extension, which is going to be more glutes and hamstrings. We could have our weight forward, kind of like a front squat, and work the quads more. So there's always a lot of things that we could focus on, but just make sure you try to pick one, because remember, the more weight or the more load that you have, the more stress it is on the joints and the risk of injury goes up. So we don't have to use heavy weight. Does it transfer? So that's always a good topic, because we see bench press, box squat, deadlift, and we have to think, all right, if we're in this position and we have no rotation, no flexion of the spine, we don't do that out on the field. We certainly don't lay on our back and press, all right? So that's always thinking about, does it transfer? We should probably be doing a lot more transferring power from the ground up. So if you were to stand on, let's say, ice or a slide board and try to throw a medicine ball, you lose that friction, and that's how you're going to generate that force, all right? So people always talk about the core. I always kind of laugh about that. People say, engage your core, activate your core. Unless that person was coming in walking like this, about to fall over, their core is on. Everything is a core exercise unless you're strapped down working one joint. So kind of something we always jump to conclusions. Another thing you'll hear talked about is, if someone has lower back issues, they'll say, oh, you have a weak core. Well, it could be the pelvic tilt. So if I'm here into this anterior pelvic tilt, I get a lot of compression here, especially with ab exercises. If I have a posterior pelvic tilt, then I'm going to open up the space between those discs and not get that compression. So this one is going to be, this posterior pelvic tilt is going to be more optimal for trunk flexion, like ab exercises, because we can actually bring that pubic bone and sternum closer together. So that's definitely something to take into consideration. All the heavy lifting, we could be losing range of motion. And not only are we losing range of motion, but we're losing the range that we need for rotation and explosion to be more dynamic athletes. How is it applied? This is always an interesting topic. So again, if we think about dropping a 5-pound weight or placing one on the ground, we've got to remember that force is mass times acceleration. So if we're using an elastomer or a band, we can create whatever force angle we want, right? But if we have, whether it's a medicine ball, a kettlebell, a bumper plate, a barbell, our force angle is straight down because it's gravity, right? So we're really, if we're just using those weights and throwing weights around, then we're missing out on a lot of really cool stuff that we could be doing with elastomers. A lot of the launch timing stuff with medicine balls, it's great. However, you're really just kind of getting that momentum going and then launching where you're the strongest. So we can be a lot more precise with using elastomers. So back to the forces, mass times acceleration. Local school, there's a strength coach that'll have guys jump up with a hex bar, jump up with hundreds of pounds and stick the landing. So again, if we think about it, all that weight crashing down, if you've got 200, 300, 400 pounds crashing down, it's probably 500 or 600 pounds of force. You know, we had some kids get injured. I think 1 or 2 might have needed surgery, but coaches and strength coaches, be careful to jump up with weight and come crashing down with it and try to stick that on these kids that are still growing. It's pretty dangerous. You could have them go slow and controlled, work on more time under tension. You could add a secondary force angle. So if you need any suggestions, definitely reach out. I'd love to help out and keep these athletes safe. Generating power from the ground up. So again, back to the core. People always say you generate power from your core. If you're in the pool or you're in outer space, absolutely. But if you're trying to generate rotational power, one hip is doing flexion, the other one's doing extension. That's how you're able to generate rotation, all right? So we can work on this all we want, but if we have an instability from the ground up, it's going to limit dramatically the amount of force we can produce up the chain. So a good way to think about that is pushing off. So we're pushing off, we're going into hip extension or knee extension, pushing off with plantar flexion. Really not much going on with the trunk except for some rotation. So as we get up to doing more powerful things with rotation, yeah, we're definitely going to use the trunk or the core. But if we're not stable from the ground up, we're going to limit how much force output we can actually have. We can also structurally limit our trunk rotation. So definitely something to take into consideration. So I'm Elite Edge Fitness or Elite Edge Training Center in Chamblee. If you have any questions or if you'd like any help with your program, I'd love to help out. I know this was kind of a condensed talk, but I'm here if you guys have any questions or need some help. So the website's eliteedgeatl.com. If you want to learn more about the muscle testing or positional isometrics or just some ways to do some new things in your strength and conditioning, I'd love to hear from you. So I have a lot of $1 million athletes that come here, a lot of agents, strength coaches. So I love teaching them new things. I also teach a class here that specializes in resistance mechanics and how to properly apply them and apply the progression. So I'd love to help out. And thanks so much for letting me speak at the clinic.